and how to counsel the patient. We are going to have the first speaker, Dr. Chandrakanth. He is speaking on patient selection and counseling for premium IOLs. Dr. Chandrakanth, please.
Good afternoon, everyone. The topic is patient selection and counseling for premium IOLs. I'll be passing general comments only. I will not go into specificities of each IOLs, be it toric, EDOF, because I think that will be spelled by spoken by other people. Things to focus during counseling: explaining the surgery and what to be expected after surgery. Then discuss the benefits of cataract surgery. Manage patient expectations. Address any patient concerns. And of course, provide post-operative instructions. In this aspect, I would like to divide my talk into points to focus during counseling and what is right for whom, patient selection criteria. Points to focus during counseling: explain surgery and what to be expected after surgery. Explain the procedure and what they can expect before, during, and after surgery. Provide with a clear understanding of what the surgery involves, how long it takes, and what they can expect in terms of recovery time. Patients should be made aware of any potential risk and complications associated with the procedure. But here you'll have to be careful that you don't have to open your mouth saying that the later complications like retinal detachment, endophthalmitis, panophthalmitis, such things and all should be handled very carefully. Explaining surgery and what to be expected after surgery. What to do if they experience any issues in the due course of the surgery. The benefit case, discuss the benefits of the surgery. Patients who have cataract often experience significant vision loss, which can impact their daily activities and quality of life. Cataract surgery can improve and reduce the risk of falls and other accidents, making it an important procedure for many patients. By discussing the benefits of surgery, it can help patients feel more confident in their decision to move forward with the procedure. Then next you have to manage the patient expectations. While surgery can improve vision significantly, it is important to explain that patients may still need glasses or contact lenses and any other procedures after surgery for a better visual rehabilitation. Of course, discuss the different types of intraocular lenses available in the market and help them to choose the one that is best suited for their daily needs and lifestyle activities. By setting realistic expectations, you can help patients avoid disappointment and frustration, and they can be a good ideal candidate for your surgical procedure. Then the important thing is to address the patient concerns. It is important to address the concerns and answer any questions they may have. Patients may be worried about the pain, the length of recovery process, or of course, the cost of the procedure. Addressing these concerns can help patients feel more comfortable and confident in their decision to have cataract surgery. Provide post-operative instructions. It is important to provide patients with detailed post-operative instructions to help them manage their recovery. Information how to take care of their eyes, scheduling the follow-up appointments, and experience any complications. By providing clear instructions, you can help patients recover more quickly and avoid any potential challenges and build a better ophthalmologist and patient relationship. Now the next division, that is what is right for whom, patient selection criteria. This depends on the patient's personality, the near far wherever you go, the value determination, preoperative refractive errors, young patients, ocular comorbidities, and previous refractive surgery. Selecting the most important implant for a patient can sometimes feel like making a match maker. While the patient loves the lens you recommend for years to come, will the lens enrich their life and support them in activities they love? Cataract surgeons say this process begins with a thorough conversation with the patient, and here at the end, the IOL selection process becomes easier, so the surgeon will come to know what best IOL these patients' options are. Coming to the patient personality matters best. Here, how will the patient tolerate phototic phenomenon, or will he be willing to sacrifice some quality of vision in exchange for a spectacle independence? There could be easygoing patients, there could be demanding patients. Each type of these patients should be taken care individually and their expectations taken into account before you decide to implant an intraocular lens. Near, far, wherever you are, the patient's visual goals are key for selecting the appropriate optics. Prioritize seeing a distance, intermediate or near. Do they want full spectral independence, or are they okay with wearing glasses for some activities? We try to understand how patients want to use their eyes, and the best way to do this is by learning what the patient's daily life is like, what they want out of their vision. It could be monofocals, monofocal plus, multifocals, trifocals, EDOF lenses, CRV accommodating lenses. Value determination. Here again, the monofocals are usually covered with cataract surgery by insurance, but insurance companies don't provide premium IOLs. In that case, the patient has to bear the full expense from out of the pocket. Patient must understand that there's an elective portion to this as well as a medical portion. The more patients understand before surgery, the more empowered they are to make their own decision and feel like they are part of the process. Preoperative refractive error. One of the major factors to consider in IOL selection is besides personality is the patient's preoperative refractive error. Moderate myopes between -2 and -4D are used to taking off the glasses and being able to see up close. They basically got a telescope built into their eyeball. If you take away these patients' near vision, they will be very upset. High myopes also will have to be very careful while selecting the lenses. Young patients, when faced with a young patient who is a cataract or young refractive lens exchange patient, think about what might happen in the next 20 or 40 years of the patient's life when he selects an IOL. Refractive lens exchange may have a perfectly healthy eye at a time, but we don't know what their eyes will look like after 20 years. In case of epiretinal membrane, macular edema, diabetic retinopathy, we'll have to take care of this. Then, of course, the ocular comorbidities like surface dryness, meibomian gland debris, astigmatism, corneal dystrophies. This has to be taken care, especially if you're advising a multifocal intraocular lenses. And of course, you have to keep in mind the previous refractive surgery. If he has undergone a radial keratotomy, LASIK, RK, PRK, various formulas are there. ACRS, IOL power calculation formulas are there. Take care of these things before you advise any intraocular lenses in patients who have already undergone previous refractive surgery. Thank you.
Thank you, Dr. Chandrakanth, for the detailed counseling.